we have, most patients have an adverse event, mostly grade 1, grade 2 adverse events. The most common grade 3 adverse events were hematologic. There was neutropenia. There was in general transient and improve upon treatment with growth factor or just omission of those, and anemia, which is a very common thing in patients with multiple myeloma. Of course, the AEs of greater interest are really the cytokine release syndrome. We saw that in 3/4 of the patients, particularly at the higher doses. Different from what we see, for example, in CAR T cells, cytokine release syndrome here is usually it starts very early, usually on day 1 and day 2, and is very short-living. And rarely goes beyond a grade 2. We had, unfortunately, one episode of a death due to cytokine release syndrome, but that was on a patient who had multiple contributing factors, including concomitant infection. The other safety signal of interest is in terms of infection. We had 30% of patients who had grade 3 or higher infection.